guys, welcome back to Neuronify, and we are here again with our next chapter, which is medico-legal aspects of sex, marriage, family planning, and infanticide. And I hope you people are enjoying this series. So yeah, we'll be covering important questions from this chapter in this video. And yes, as I say every time, without wasting a single second, let's begin this session. Very first question, which is amended section 375 IPC, we have to define it. And how will you collect evidences in victim of rape? So in question they have asked about victim of rape, but now we are going to study about the examination of accused in rape, and examination of victim would be studied later. So I'll first read about the examination of accused in rape, the one who performed the rape, or the one who carried out the rape. For any examination of accused of rape, written informed consent is must. If consent is not given, reasonable force can be used for his examination under section 53(1) CRPC. So examination includes preliminary data, same as in victim of rape, history also as in victim of rape, examination of clothes for any tears, any stains, mud, grass, blood, semen, lipstick or face powder, any foreign material, then examination of body, physical development, height and weight, then intoxication, whether any drug was consumed or not, whether consumed alcohol, and whether he is so much under the influence of alcohol so as to be rendered impotent. Then what about the secondary sexual characters? We have to describe them also. Then for age, including examination of teeth and of bones. Then nails for blood or epidermis of victim. Then any injuries, nail scratches or teeth bite marks, any stains, any foreign bodies. So in examination of body, following points would be considered regarding physical development, intoxication, secondary sexual characters, age, nails, any stains and any foreign body. What about the examination of genitals? Physical development of genitals is seen, congenital anomaly if present, any foreign body, in case of sodomy, presence of fecal matter, and in buccal coitus, saliva and bite marks on penis. Any stains, presence of smegma, whose presence indicates that he is not involved in recent sexual intercourse, evidence of STD, and presence of spermatozoa in urethral discharge confirms recent seminal emission. Then we have to check for any injuries. Though no injuries may be present, then maybe abrasions, contusions on penis due to forcible penetration through tight opening. Then maybe rupture of frenum, or what is frenum, especially in forceful complete penetration in children. Due to nail scratches by victim, due to teeth bites by victim. In extreme cases, the victim may bite off or cut off the penis, which is called as Bobbitt syndrome. So evidence of vaginal secretions and cells, moist filter paper is rubbed on the glans penis and then exposed to vapors of Lugol's iodine. Then brown color if seen due to rich glycogen content of vaginal secretion. So on moist filter paper rubbed on glans penis, it is added, Lugol's iodine is added, which is of blue color. So if blue color is converted to brown color, then we say ki Lugol's iodine test is positive, which means recent intercourse has been observed. Then smear meat from glands stained, stained with Papanicolaou stain, examined under microscope for vaginal cells. So what are the two stains? Number one, Lugol's iodine, and number two, Papanicolaou stain. Then what about the inference and opinion? Whether he has involved himself in sexual intercourse, details of injuries on his body and clothes. A visit to the scene of crime helps to form better opinion. So these are the points in your examination of accused of rape. You have to first check for examination of preliminary data, then history, examination of clothes, then body, genitals, even your any injuries, then evidence of vaginal secretions and cells. Then we have to form an opinion. So this was all about the examination of accused of rape. Now what is the definition of section 375 IPC? As per section 375 IPC, rape is defined as unlawful sexual intercourse by a man of a woman, his wife less than 15, either of a woman or his wife less than 15 years, or any woman less than 16 years with or without her consent, or any woman of or above 16 years against her will, without her consent, or when the consent is obtained by an illegal method. So this is nothing but your 375 IPC. So what is rape? Rape is defined as unlawful sexual intercourse by a man of a woman, or his wife less than 15 years, or any woman who is less than 16 years with or without her consent, or any woman of or above 16 years against her will, without her consent, or when the consent is obtained by an illegal method. So that is called as your rape. Now what is illegal method? Like putting her or anyone else in whom she is interested in fear of death, putting her or anyone else in whom she is interested in fear of hurt when she is under influence of drinks or drugs or of unsound mind. By impersonation, that is, the man knows that she is not his wife, but she gives consent presuming him to be the man to whom she is lawfully married. Or by misrepresentation of facts. So these are the points under which consent obtained is illegal. So consent obtained in fear of death, fear of hurt, unsound mind, impersonation, and misrepresentation of facts. So this is called as your 375 IPC. Important point to notice, 375 IPC has now changed to section 63 BNS, and the punishments for this crime are included from 64 BNS to 70 BNS. So this is very important point. Question would be define section 63 BNS. So in that you have to define rape and the consent by illegal methods. So this was all about this question. Moving to next question, we have what is testamentary capacity? We have to describe. So mental illness and testamentary capacity. Testamentary capacity, testament means will. It is the mental ability of a person to make a valid will. Will denotes any testamentary document. Section 31 IPC. IPC has now changed to BNS. So testament means will, and it is the mental ability of a person to make a valid will, and any will denotes any testamentary document. Now, what are the requirements of this testament? The requirements for a valid will are as follows. A written and properly signed and witnessed document must exist. The testator must be mature and of sound disposing mind at the time of making the will. Force, undue influence, or dishonest representation of facts should not have been applied by others. A sound disposing mind is a mind which has capacity of recollecting, judging, and feeling the relations, connections, and obligations of his family and blood relations. Holograph will is one which is written by the testator in his own handwriting. So what they are trying to say, what are the things which are required in will? It should be written and it should be properly signed. Then we also have holograph will, in which the will is written by the testator himself. And the medical examination, doctors are sometimes called upon to witness the execution of the will of a sick person. The doctor should proceed in the usual way, that is physical examination, mental state including intelligence testing, and lab investigations. The testator is said to be of sound mind if he is capable of disposing his property with the understanding and reason. The following tests are recommended to find out whether the testator is of sound and disposing mind. Number 1. Ask the testator preliminary questions, example about his relatives, their number and the degree of social contact with them, his opinions on family, friends and business partners, his age, politics and hobbies. Ask general questions for testing awareness as regards time, place, etc. Then you have to ask him about the nature, extent and value for his properties and the manner of distribution desired by him. If any unusual or unjust distribution is to be made, find out whether it is intentional and if so the reasons for it, and whether he is able to repeat the main provisions of will. And test the patient's powers of concentration by simple sums of arithmetic, and ask all other persons to leave the room, and then ask the patient whether there was any pressure or influence on him by anyone. The doctor should exclude any disease, infirmity, pain, strain, influence of drug or drink, or any insane delusion which are bound to affect a normally sound and disposing state of mind. Drugs or their withdrawal may cause changes in consciousness, reasoning ability, perception of reality, and memory. Then it affects the individual's testamentary capacity. The most common symptom of absence of legal capacity is impairment of memory. So impairment of memory is going to be most common symptom of absence of legal capacity. Prejudices, dislikes and hatred, however ill-found or however strongly entertained, cannot be classed as due to mental illness delusions. So what they're trying to say, any type of prejudices or dislikes and hatred, then however ill-found or however strongly entertained, cannot be classed as due to mental illness delusions. So if a person is under mental illness delusions, then that testament or that will is not considered as valid. Dislike of one's relatives without reason is not necessarily proof of want of capacity. The most important thing to determine is whether at the time of making the will, the testator understood the business in which he was engaged and knew how he wanted to dispose of his property. So at the time of will, if the person is aware of everything, then that will is considered to be valid will. Now what is valid will? A person is affected by delusions due to unsoundness of mind can make a valid will if the delusion is not related in any way to disposal of the property. They're trying to say even if the patient is suffering from delusions, and those delusions are not related to the separation or segregation of the property, which is disposal of the property, then that will is considered as valid. Or the persons affected by the will. Persons can make valid wills during lucid interval. What is lucid interval? We all know that there is a normal interval between two convulsions, okay, or two fits, or say two tremors. So that interval is called as your lucid interval, and the person is held liable for any crime which he or she performs in this interval. A will is considered valid even though the testator committed suicide shortly after making a will, if there is no other evidence of mental disorder. So that then also will is considered as valid. Persons of extreme age and feeble health with defective memory can make a valid will unless their mind has become so impaired that they are unable to understand its nature and consequences. A person suffering from motor or sensory aphasia, agraphia, which is failure to communicate by writing, and alexia, which is failure to understand by reading, or who is deaf, dumb, or blind, can make a valid will if he knows what he does by it, if he can make clear by gestures that he wishes to make a will, and is able to understand the meaning of questions put to him in his connection. So, broadly, anyone can make will, whether a blind person, deaf person, dumb person, but the point is the person should be conscious about the disposal of the property, and he should understand that he should understand the act, and he should understand the business in which he was once what do we say in which he was once involved. So that is nothing but certain conditions to consider a will as valid. Then sixth point is, an eccentric person can make a valid will if there is no other mental derangement or a delusion. Features of invalid wills. Wills made by persons in extremes, that is at the point of death, may be regarded with suspicion because at that time a clear mind is unusual. So for a valid will, clear mind is very important. The will executed by a dying person during delirium would not be valid. Partial drunkenness does not invalidate a contract or a will, but when drunkenness has caused a temporary loss of reasoning powers, the person cannot make a valid will. So partial drunkenness is okay, but if the person is undergoing, if the person has ingested a large amount of alcohol which has led to the unconsciousness or say temporary loss of reasoning powers, then that is considered as invalid will. An executor is appointed under the will by the testator to carry out terms after his death. So, an executor is appointed under the will by the testator to carry out terms after his death. So, this was all about the features of valid wills, invalid wills. Now, we are moving towards the next question, which is delusion. You have to, very important SAQ, and we have to write the types of delusions. So, what is delusion? It is a false but firm belief in something which is not a fact, which does not exist. Basically, we believe in something, it is completely false thing, the thing is not in existence, but we are going to have, or say we have a very strong belief on that. So that is nothing but delusion. What is delusion? A false but firm. Okay, false belief but a firm belief in something which is not a fact, which does not exist. It persists even when the falsity is clearly demonstrated. Even if we know that this is completely false, then also we tend to believe with very much, very much faith, very much belief. So that is nothing but delusion. Delusion is a sign of insanity. It can affect the conduct and actions of the sufferer so as to drive him to suicide, murder, or other crimes. He is not held responsible for his acts. So if a person is undergoing delusion, then that he is not liable for his crimes. The various types of delusions are very important. SAQ. Nihilistic delusion, that is there is no world, he is dead, etc. So that is nothing but nihilistic. Nihilistic, I'm so sorry, it is nihilistic. Nihil means no, listic means world. In that way you can memorize. Literally, that is not the meaning of nihil, but for the sake of remembrance, I thought that would help. Nihilistic, no world. What is hypochondriacal delusion? Like he has cancer. Hypochondriacal. Okay. Delusion of poverty, that he is very poor. Delusion of grandeur, that he has divine powers, untold wealth and approach. Delusion of sin, that he has committed some sin. Delusion of guilt, that he is guilty of particular act. Delusion of self-accusation, that he is the accused of a particular crime. Delusion of reference, that he is being referred to in talks on TVs, etc. Delusion of influence, that his ideas are being influenced by someone. Then delusion of jealousy, he becomes jealous of somebody for no reason. Delusion of fidelity, suspects the fidelity of wife and may assault her. Then delusion of persecution, that attempts are being made to kill him, usually by the close relatives. So that these are the 12 types of delusions. Number 1, delusion of grandeur, delusion of poverty, delusion of reference, influence, jealousy, fidelity, persecution, and you have sin, guilt, self-accusation, and nihilistic and hypochondriacal. I hope you people understood nihilistic. It means no world, he's dead. And what is hypochondriacal, which means the patient has cancer. So these are the types of delusions. Very, very, very important SAQ. Moving to next question, what is true and feigned insanity? What are the differences? So we have certain points which differentiate um, in true insanity from the feigned insanity. So number 1, so in total we are going to have 11 points. Yes, 11 points we are going to differentiate based on these 11 points. Number 1 is onset. True insanity is very gradual. You'll get to know ki yes Baba, this is truly insane person. What about feigned insanity? Onset is sudden. What is the motive? Motive is absent in true insanity. Motive is present in feigned insanity. Causes predisposing or precipitating, always and always present, but these are absent in feigned insanity. What about the facial expressions? These are peculiar in true insanity and those are normal in feigned insanity. Signs and symptoms of particular type, not uniform, usually a mixture of insanity. Physical manifestations, wrinkled and moist skin, constipation, furred tongue, loss of appetite, and insomnia present. Okay, so loss of appetite and insomnia present. So that these are nothing but your physical manifestations, and these manifestations are completely absent in false insanity. What about habits? Dirty, filthy nonsense. But these are not so in your false insanity. Though may smear his room with feces and other filth if he has seen a true lunatic doing so, but he spares his body and leaves enough space for sleeping. So, unique feature to identify or to differentiate true insanity from false insanity. What about effect of observation? No effect in behavior, but change is present upon observation. Total remission of symptoms when he feels that he is alone and unobserved. What about repeated examination? No concern is there. Resents frequent examination for fear of detection. Exertion, no effect, not exhausted. Soon exhausted, perspiring, and feels sleepy. Recovery usually slow, and it is very fast after the release from hospital. So these are the differentiating points. 11 differentiating points of true insanity and your false insanity. What are those? Onset, then motive, causes predisposing or precipitating, facial expressions, sign and symptoms, physical manifestations, habits, effect of observation, repeated examination, exertion, and recovery. Coming to next question, which is impotence and sterility in both sexes. What are the causes? What is artificial insemination, and what are the guiding principles? Again, an important question. So what are the causes of impotence and sterility in males as well as females? But firstly, you have to understand what is the meaning of impotence and what is the meaning of sterility. So number 1 point is we'll learn about males first and then we'll go to females. Okay, then again we'll be differentiating males and females. So I think so we'll go with males first and then we'll go to females. That would be easy. Number 1, age, importance. Very, very young and very, very old is important. Okay. In England, a boy below 14 is considered important. Now, what is important? Impotency means the person is not able to ejaculate. The person is not able to erect the penis, and that is nothing but your impotence in males. Sterility before puberty, 13 to 14 years. Obviously, everyone is sterile. Males are sterile before 13 to 14 years. Records in which at 2 years penis and testes were developed. Then at 9 years the son became father, and at 94 years a person, or say a male, became father. So these are the exceptions as the medical case records. But remember, generally impotence is very, very young and very, very old, and sterility is before puberty, that is 13 to 14 years. Now what about congenital malformations? Impotence. In impotence, absence of penis, rudimentary penis, double penis, intersex states, that is Klinefelter syndrome, and penis adherent to scrotum. What about sterility? Sterility is absence of testis, single testis, undescended testis, epispadias, which is urethral opening on dorsum of penis, hypospadias, or say hypospadias, which is urethral opening on undersurface of shaft of penis. So epispadias, dorsum, and hypo, which is on the undersurface of shaft of penis. These are the congenital malformations. Now, what about local and general diseases? Importance: local diseases, syphilis may cause temporary impotence, gonorrhea may cause temporary impotence, then your priapism, which is painful persistent erection of penis, and your phimosis and paraphimosis. So these are the local and general diseases. What about mechanical obstruction, scrotal hernia, then hydrocele elephantiasis? Again, general diseases may cause temporary impotence, which is hypertension, diabetes, tuberculosis, nephritis, fevers, and infections. What about neurological? Paraplegia, hemiplegia, injury to spinal cord, and injury to vertebrae. What about carcinoma of penis? Um, Sterility, infections of testis, epididymis, prostate or vas deferens, varicocele, mumps causing orchitis, leprosy, syphilis, tuberculosis of testis, then ozoospermia or oligospermia, testicular tumors, hormonal disorders. So these are the sterility points in your carcinoma of penis. What about injuries and addictions? Impotence is because of injuries and addictions as well. So injury to head, spinal cord, cauda equina, or what is cauda equina? Recall from anatomy. Or penis. Then addictions to tobacco, alcohol, narcotics, morphine, pethidine, heroin, barbiturates, cannabis, cocaine, bromides, etc. Then antihypertensive drugs. So these may cause impotence. Now, what about sterility? Injury to both testes, heavy exposure to radiations, heavy metal poisoning, lead, arsenic, etc. So these are the some of the causes, like factors, not causes but factors, like injuries and addictions, your mechanical obstructions, basically local and general diseases, congenital malformations, and your age. So these are the factors which are going to affect the sterility and importance of males and females. Now we studied about males, now we will go to females. What about females? Age factor. Importance: no age limit, because a passive partner. Legally, a girl is considered potent at 18, which is age of marriage. Then what about sterility? Before puberty, 12 to 13 years, and after menopause, 40 to 60 years. Legal age of menopause is 50 years. Medical case records. Now, few exceptions. At 4 years, menstruation was present. At 6 years, 8 months, delivered a baby. At 10 years, delivered twins. At 63 years, delivered her 22nd child. And at 55 years, delivered twins. So these are the few medical case records. What about the congenital malformations? What about impotence? Absence of vagina, infantile vagina, occlusion of vagina, additions of labia, imperforate hymen. Then sterility: absence of ovaries, cystic or fibrous ovaries, absence of uterus or fallopian tubes, infantile uterus, septate uterus, conical cervix, non-patent fallopian tubes. So these are the points in sterility. What about local and general diseases? In impotency, vaginismus, which is painful contraction of vaginal and perineal muscles, ulceration and cankri or say chancre of vagina, prolapse of uterus, strictures due to previous perineal tears, and carcinoma of vagina. So these are the points under impotence in local and general diseases. So whenever you get local and general diseases, remember cancer. Don't forget to write that. Yeah. So what about in carcinomas? You'll write about sterility, which is infections of ovary, fallopian tubes, uterus or cervix. Then leukorrhea, which is may sometimes cause sterility. Acid discharge from vagina, rectovaginal fistula, hydrosal pinks, large fibroids, ovarian tumors, carcinoma of ovary, carcinoma of uterus, cervix, prolapse of uterus, hormonal disorders, and antibodies against sperm. So these were the points in carcinoma, the points under sterility. What about injuries and addictions? Impotence: injury to vagina, strictures due to scarring of vagina, and this parageunia, which is pain during sexual intercourse. Sterility: injury to both ovaries, heavy exposure to radiations, heavy metal poisoning, and drug addictions. So these are the factors under which you are going to differentiate impotence and sterility in males as well as females. What are the factors? Age, then we have congenital malformations, local and general diseases, and your fourth point is addictions and injuries. Now, what about psychological causes? This can lead to only impotence and not sterility. It is the most important and common cause of impotence in male, can even cause first night impotence, that is fear, worry, mental depression, emotional disturbances, mental disturbances, dislike for the partner, dislike for the act, fear of not being able to complete the act, overindulgence in sex, sexual pervert, excessive passion, etc. In females, impotence may be due to vaginismus or hysterical fit. That is nothing but your psychological causes. Now, what about operations? Operations is also one of the factor. So operations in males: impotence, partial or complete amputation of penis and castration before puberty; sterility, vasectomy and orchidectomy, which is removal of testes, castration. What about importance in females? Major surgery on vagina and sterility, that is tubectomy, oophorectomy, and hysterectomy, removal of uterus. So these are the factors which affect the sterility and importance in males and females. What is functional importance? It refers to the importance for which no somatic or morphological cause can be found out. So that is nothing but your functional importance. Moving ahead with our next question or next point, which is artificial insemination, AI. Definition: artificial insemination is a method of depositing semen with the help of syringe in vagina, uterus, or on cervix to bring about pregnancy, which could not be attained by normal sexual intercourse. Now, what are the types and indications of AI? AIH, that is artificial insemination homologous, or say artificial insemination husband. Semen of husband is artificially inseminated in case if he is impotent but fertile, then epispas dias or hypospas dias. AID, artificial insemination donor. The semen from a donor is deposited in case if the husband is sterile, husband suffering from inheritable disease, and husband suffering from inheritable psychiatric disorder, and if there is RH incompatibility. What about AIC or AIHD? Artificial insemination combined or artificial insemination husband donor or pooled semen. So in this case, the semen of husband and donor is pooled, combined, and then deposited in case husband is oligospermic. Oligospermic means less number of sperms. So this is nothing but your conditions under which or indications under which we perform artificial insemination. Artificial insemination husband, artificial insemination donor, and artificial insemination combined. What about procedure? After written informed consent of all the consent parties, semen is collected by masturbation after 1 week of abstinence and is checked for HIV. Then 1 ml of semen in sterile syringe is diluted with 1 to 2 ml of normal saline and is then deposited on cervix within 2 hours of collection of semen at the time of ovulation, that is 14 days before the next menstruation. The procedure is done in the presence of a nurse and female attendant for 3 to 4 days per month for 3 to 4 months or till conception. If using stored semen, donor tested for HIV. If negative, sample is collected, sample stored for 3 months by cryopreservation. Then retested for HIV. If still negative, retested for HIV. If still negative, then it is used for artificial insemination. If no facilities for preservation, use after one ELISA test with consent of the recipient. So this is all about the types and indications of AI and the preservation of semen. Now, what are the precautions in AIH? Consent of husband and wife both required. Procedure done in presence of female nurse and attendant. In AID, written informed consent of recipient, her husband, donor, and his wife. Also consent taken that semen will be donated by masturbation. Procedure done in presence of female nurse and attendant. Identity of donor and recipient should not be revealed to each other or to their relatives. Then the donor should not be informed of the result of insemination. Donor should be below 40, having his own children, not related to either spouse, should resemble the husband in race, physically well, not suffering from any inheritable, communicable, or psychiatric disorder. RH compatibility should be checked, and doctor himself should not be the donor. Remember. Then the doctor doing AI should avoid delivering the child, as there will be difficulty in writing birth records and paternity. So what are the legal problems? In AIH, no legal problem is there, but in AID, actually it is wrong to register the husband of a recipient as father of child. Then so child is illegitimate, so child cannot inherit property. The recipient and donor may be sued for adultery by their spouses. In case of birth of a defective child, doctor may be sued. There are chances of incest, as a habitual donor may be father of many children. Then AI is not common in India, but the legal consensus is husband of the recipient is father of child, so child is legitimate. Fine. Because consent taken, as there is no physical union, no question of adultery. Even a single or divorced lady can have artificial insemination, but the child will be illegitimate. What about surrogate mother? Definition: it is defined as the lady who rears in her womb the fetus of others and for others. Procedure: in case a female cannot become pregnant, so her ova is fertilized in vitro with semen from her husband, and the fertilized ova is implanted into the uterus of surrogate. At times, either of ova or semen can be taken from donor, then it is full surrogacy. Alternatively, the semen of a husband is artificially inseminated into the surrogate, that is called as partial surrogacy. So semen is artificially inseminated into the surrogate mother. After delivery, the child is handed over to the biological parents by the surrogate. Usually, surrogate motherhood is done for commercial purposes. What are the legal problems here now? Surrogate may not keep up the promise and may refuse to hand over the child. Surrogate may later demand more money. The biological parents may not later desire to have the child and may force the surrogate to abort. There may be problem of inheritance of property, especially in Muslims who can will only 1/3 of their estate and rest goes to their natural heirs. So these are the points regarding your artificial insemination. We learnt about the indications and the types, AID, then AIH and your AIC. Then we learnt about the surrogacy and the conditions. Now moving to next question, which is probable signs of pregnancy. So what is pregnancy? It is defined as the condition of having a developing embryo or fetus in the uterus. Ovum is fertilized in isthmus of fallopian tube 12 to 24 hours after ovulation, comes in uterus on the 4th day after fertilization and gets embedded in the endometrium of the uterus 7 days after fertilization. The product of conception is known as zygote up to 9th day. Embryo during so the product of conception is known as zygote, and up to 9th day, embryo during 9 days, 9 weeks, and later it is known as fetus. So basically what they are trying to say, product of conception is called as zygote up to 9th day. Up to 9th day we are going to call it as zygote, but from 9 days to 9 weeks we are going to call it as embryo, and later we are going to call it as fetus. When ovulation occurs, there results the rupture of Graafian follicle and it is replaced by, so basically in pregnancy, try to elaborate everything. Try to elaborate every possible, every possible method, or say every possible process in order to elongate the answer. So when ovulation occurs, there results the rupture of Graafian follicle and it is replaced by corpus luteum, which secretes the hormones to prepare the endometrium for implantation and progress of pregnancy. So if pregnancy occurs, it remains active and therefore no further ovulation or menstruation occurs. While if no pregnancy occurs, the corpus luteum regresses after about 2 weeks. So in this way, there is ovulation and later fertilization. What about medico-legal aspects of pregnancy? The lady puts forth pregnancy as a bar to face trial in the court. Can be exempted only if delivery is imminent, which means the court can delay the orders if the victim, or say if the accused is pregnant. Not victim, but the accused is pregnant. The lady puts forth pregnancy as a bar for capital punishment. The High Court may postpone the death sentence to 6 months after the delivery or may change it to life imprisonment. Pregnancy at the time of marriage is a ground for nullity of marriage. Pregnancy when she had no access to a husband, the husband can ask for divorce, the other man can be sued for adultery, and the child if born will be illegitimate. And what about fifth point? In case of divorce, it holds herself liable to greater maintenance allowance on ground of pregnancy. On death of husband, holds herself liable for greater compensation. On death of husband, holds herself liable to inherit more property. When a pregnant charges somebody with breach of promise of marriage, then there can be breach of promise of marriage as well. When a pregnant blackmails somebody alleging that her pregnancy is through him. When a girl is being blackmailed for being pregnant. When a girl below 16 or married below 15 becomes pregnant, it is a case of rape. When a girl becomes pregnant after being kidnapped, then when a girl requests for MTP stating that her pregnancy is due to rape, when a pregnant lady is being charged with criminal abortion, infanticide or secret disposal of a newborn, then when pregnancy becomes a reason for suicide or homicide. So these are the medico-legal aspects of pregnancy. What are the signs of pregnancy in living, in dead, and diagnosis of fetal death in utero? So in living female, what are the presumptive signs? Suppression of menstruation is the main sign. Morning sickness, symptomatic disturbances, changes in breasts, pigmentation of skin, changes in vagina, quickening, urinary disturbances. These are the presumptive signs. What about the probable signs? Changes in abdomen, softening of lower uterine segment, softening of os, cervical mucus plug, intermittent contractions and relaxations, ballotment, uterine scoffle, then immunological tests. What about positive and confirmatory signs? Fetal heart sounds, palpation of fetal parts, palpation of fetal movements, radiography and ultrasonography. So these are the three signs. Number 1, probable, presumptive and positive. What about presumptive signs again? On the basis of these signs, pregnancy can only be presumed, not confirmed. Therefore, these signs are unimportant medico-legally, except quickening. So suppression of menstruation with pregnancy, there is suppression of menstruation, but what are the fallacies? Non-menstruating may become pregnant. Pregnancy may occur during lactational amenorrhea. Menstruation may continue in early months of pregnancy. Amenorrhea may result due to uterine, ovarian, or emotional or endocrinal disorders. Menstruation may cease in unmarried due to fear and nervousness after illicit intercourse, and in married having intense desire for pregnancy. What about morning sickness? So what they're trying to say, that it is not necessary कि recession of menstruation is going to be called as pregnancy. The woman is going to be called pregnant. No, it may occur due to many reasons. It may be because of your PCOs now changed, renamed as PMOs, or say because of any emotional disorders, hormonal changes. So these are the reasons for the recession of menstruation. Similarly, morning sickness, it may occur due to traveling also, not just because of pregnancy. So these are the some points or fallacies in presumptive signs. So in some pregnant, especially preemie, during 2 to second or fourth month, there is nausea and vomiting, mainly in morning hours. So if excessive, it is known as hyperemesis gravidarum. Then fallacies. What are the fallacies? Nausea and vomiting may even be due to migraine, worm infestations, or gastrointestinal disorders. Manifestation is rare in multipara. What about sympathetic disturbances? In some, there is excessive salivation, perverted appetite, that is pikas of pregnancy, loss of temper, and easy fatigability. Then changes in breasts. From second month, breast starts enlarging, areola and nipple darkens. Then Montgomery tubercles, which is enlarged sebaceous glands, becomes prominent at the margins of areola. From third month, a yellowish thin secretion known as colostrum, having large phagocytic cells and small fat globules, can be squeezed out. At about 10 days after delivery, it is replaced by milk. So white thick secretion having small phagocytic cells and large fat globules. From 6th month, nipples enlarge, breast become firm, nodular and tender. Veins become prominent, linea albicans, that is silver lines appear on the lateral margins. These white streaks appear as a result of scarring of ruptured subcutaneous tissue due to enlargement. So these are some features which are observed month-wise in a pregnant woman. Now what are the objections? Breast changes are important only in first pregnancy. After delivery, milk secretion is almost a permanent phenomenon. Milk secretion may sometimes occur in non-pregnant or due to oral contraceptives or ovarian tumors. What about pigmentation of skin? Vulva becomes dark. A dark line appears from umbilicus to vulva known as linea nigra. Areola becomes dark. Eyelids, cheeks and axilla darken known as chloisma. Eyelids, cheeks and axilla are darkened, that is known as chloisma. So again, what are the objections? Changes seen only in fair. Changes are unimportant in subsequent pregnancies. Now what about changes in vagina, that is Chadwick's sign or say Jacquemus sign? After 4 to 6 weeks, due to increased circulation and stagnation of the blood as a result of compression by gravity uterus, the color of vagina changes from pink to violet to blue. Vagina becomes soft and secretions increase. What is quickening after 4 to 5 months? It is subjective feeling of the mother of the movements of child. At this stage, lady is said to be quick with the child. This sign has medico-legal importance. Now, what are the objections? It is a subjective feeling. Peristalsis may be confused with quickening. Then urinary disturbances due to pressure of gravate uterus and bladder during early pregnancy and also in third trimester when head descends in the pelvis, there is increased frequency of micturition. What are the probable signs? With these signs, the probability of diagnosis of pregnancy is relatively high, but not absolute. Then, what are the changes in abdomen? With progress of pregnancy, abdomen distends, which is at 12 weeks, fundus can be palpated behind pubic symphysis. At 24, at umbilicus, at 36, at xiphoesternum, and at 40 weeks, 2 inches below the xiphoesternum. Then, linea albicans, which is trigravidarum, appear on lateral aspects and lower abdomen. What about 7 months? Umbilicus is in line with the abdomen. Later it is everted. Okay, so these are the changes in abdomen observed of a pregnant woman after delivery. Now what are the objections? Distension of abdomen may even occur in fat, then ascites, flatus, uterine tumors, ovarian cysts and other malignancies. Now softening of segment, that is called as Hager's sign. After 6 to 8 weeks on examination with one hand on the lower abdomen and 2 fingers of the other hand on in the posterior fornix, the two appear touching each other. So without pregnancy, this is unlikely, but this is one type of sign which is called as Hager's sign. What about softening of os, that is Goodell sign or say Godel sign, whatever the pronunciation is. Non-pregnant cervix feels hard like nail. After 6 to 8 weeks of pregnancy, it is soft like lip. Okay, maximum softness is at 4 months. So cervix may become soft even in its inflammation or tumors of uterus. Also cervical opening becomes transverse instead of circular. What about cervical mucus plug? After 2 months, cervical opening is blocked by mucus. Then intermittent contractions and relaxations, that is called as Braxton Hicks sign. After 2 months, contractions of uterus start and they can be palpated through abdomen. Initially, contractions last 1 to 2 minutes and relaxations are for 20 to 30 minutes. With progressive pregnancy, the duration of contractions increases and interval decreases. May also occur in uterine tumors. What about ballotment? During 4 to 5 months, is palpation of the fetus floating in liquor amni. Can be done externally as well as internally. So one hand is kept on each of the flanks of the abdomen, one pushes and the other perceives the fetus, and in standing lady hold the lower abdomen, push the fetus and palpate when it resettles. What about internal? Two fingers of one hand in anterior fornix push the fetus and the same is perceived by the other hand kept on the abdomen. So that is nothing but your floating in liquor amni, ballotment. Two fingers in anterior fornix push and themselves perceive when the fetus resettles. Ballotment is not possible if liquor is scanty. You are going to need a plenty amount of liquor. What about uterine scoffle after 4 to 5 months? It is a soft murmur auscultated on the sides of uterus. It is due to the blood flow through the dilated uterine vessels and is therefore synchronous with the maternal pulse. May also be present in vascular fibroma of the uterus. Differential immunological test, which is Gravindex test, after 2 to 3 weeks. To a drop of urine on a slide is added anti-HCG and sensitized latex particles. Non-agglutination means positive test, that is positive pregnancy. Efficiency of this test is 98% only. Test is also positive in hydatiform mole and certain pituitary tumors. So we also perform immunological test, which is Gravindex test. Remember, you have to just remember. Just memorize main titles. Not I know the answer is very lengthy, but we do not need to write everything given in this answer. Under probable signs of pregnancy, you are going to define the pregnancy. Then you are going to write the medico-legal aspects, 15 medico-legal aspects, and signs of pregnancy in living, in dead, and diagnosis of fetal, mean headings only. So in living female, we are going to have 3 signs: presumptive signs, probable signs, and positive signs, which are confirmatory signs, right? And then if you want to explain presumptive signs, probable signs, and confirmatory signs, you may explain. But if you people will write only headings, then that is also fine. Answer is very lengthy here, but I just want you people to mention main headings in the answer, like how you are going to diagnose pregnancy in living beings, in dead, and in utero. So yeah, we'll quickly read this. Number 2 is test can also be done or performed in tube or by strip. Remember, immunological test is Gravindex test. Just remember the names of the tests. Immunological test, Gravindex test. Fine. CG, human chorionic gonadotropins levels can also be determined by radioimmunoassay analyzer. So earlier I used Zondek test, Fredman test, Hogben test, male frog test, and Galli-Manini test. So these are the tests which were used earlier, but now we are going to perform Gravindex test, which is an immunological test. Moving ahead, what are the positive signs? Fetal heart sounds, obviously. FHS can be auscultated after 4 months when the rate is 160 to 180 per minute. After 6 to 8 months of pregnancy, when the rate is about 120 per minute. So fetal heart sound may not be heard if fetus is dead, pregnancy is less than 16 weeks, excessive fat on abdomen, hydroamnios, and wrong lie of the child. So these are the signs in which we cannot hear the fetal heart sounds. What about palpation? Palpation of fetal pads after 4 to 5 months, fetal pads can be palpated through abdomen. Moving ahead, palpation of fetal movements. After 4 to 5 months, fetal movements can be palpated. What about radiography? After 3 months, abdominal radiographs show fetal bones. Then crescentric or annular shadow of skull, linear dots or beaded appearance of vertebral column, fine curved parallel lines of ribs, ladder-like shadow is there, and linear shadows of long bones of limbs. However, because of radiation hazards, radiography should not be done to diagnose the pregnancy. Now, what about ultrasonography? Remember, ultrasonography differs from radiography. So after 6 to 8 weeks, USG confirms pregnancy. After 6 to 8 weeks, echocardiography detects heart movements, and after 12 weeks, USG detects heartbeats. So these are some of the tests which confirms or which gives, which confirms the positive signs of pregnancy. Signs of pregnancy in dead female. Number 1, as in live-in, uterus Uterus is enlarged maybe up to 30 into 25 centimeters, weight maybe up to 1 kg, and fetus is present, site of placental attachment is seen in dead female, and ovary corpus luteum is seen. So these are the signs of pregnancy in dead as well as living female. Now how we are going to diagnose fetal death in uterus? In early pregnancy, the uterus does not grow in size. In second half of pregnancy, we can perform clinical examination, radiography, sonography, amniotic fluid, and immunological tests. So in clinical examination, if fetal heart sounds are absent, fetal movements are absent, uterus size does not correspond to duration of pregnancy, or in radiography there is overriding of skull bones, that is Spalding sign is positive. Remember Spalding sign. Prolapse of vertebral column, air in heart and blood vessels, and in ultrasonography, Spalding sign is positive, no heartbeat seen, no fetal movement seen. What about amniotic fluid? It is brown and turbid. Immunological tests are negative. So in following conditions, we can say that fetal death has occurred in uterus. So in early pregnancy, remember uterus does not grow in size. What about very important? What is pseudocyesis, or say false, spurious, or phantom pregnancy? In those who have excessive desire for pregnancy, all signs, even labor pains, may be present. Rarely, a woman may be ignorant of pregnancy and may know only on delivery. So basically, either the female has excessive desire, which cause even labor pains, and rare in few conditions a woman may be ignorant of pregnancy and may know only on delivery. So these are very rare conditions, but remember the term pseudocyesis, which is also called as false, spurious, or phantom pregnancy. This was all about signs of pregnancy. Remember to write everything. If even if you will write headings, that would be enough. Yeah. Moving to next question, what is parus and nulliparous uterus? Differentiated PM examination. We all know what is parus and we all know what is nulliparous, but still we are going to differentiate both of them based on the 6 features. What are those? Size, weight, length, fundus, cavity, and cervix. Talking about parus uterus and nulliparous, I'll be reading one by one. Size: 9 cm long, 6.5 centimeters wide, larger and thick. Okay. What about nulliparous? 7 centimeters long, 4.5 centimeter wide, and smaller and thinner. What about weight? 80 to 120 grams. Only 40 to 60 gram is present. 40 to 60 gram weight is observed in nulliparous uterus. What is the length? The body is twice the length of the cervix. The body and the cervix have the same length. What about fundus? The top of the fundus is convex and on higher level than the line of broad ligament. So the top of the fundus is convex and on a higher level than the line of the broad ligament. So it is above the line of the broad ligament. That is what they are trying to say. What about nulliparous? Upper surface of fundus is less convex and on the same level as broad ligament. What about cavity? The walls are concave from inside, forming a wider and rounded cavity, but the walls are convex from inside, forming a smaller and triangular cavity. In nulliparous uterus, the uterus which we see in diagrams is basically a nulliparous uterus because cavity which we draw is triangular cavity. What about cervix? Irregular and edges show scars. External os is transverse, irregular and fissured. It may admit tip of the finger. The internal os is not well defined. What about nulliparous uterus? It is regular, no scars, external os is rounded and appears as a small hollow in the center of cervix. The mucous membrane is smooth and intact and orifice is closed. Internal os is circular and it is well defined. So these are the features of parus uterus as well as nulliparous uterus: size, weight, length, fundus, cavity, and cervix. Very important question: what is battered baby syndrome? Non-accidental injury of childhood, battered child syndrome, child abuse syndrome, maltreatment syndrome, or cafe syndrome. These are various names of battered baby syndrome, and any name will be asked, or any name could be asked. Non-accidental injury of the childhood, battered child syndrome, child abuse syndrome, maltreatment syndrome, and cafe syndrome. Remember, cafe syndrome and cafe coronary syndrome are completely different. Once I got confused. I made a blunder in my exam regarding cafe syndrome was asked and I wrote about cafe coronary syndrome. So remember, it should not happen with you people, right? So non-accidental injury of childhood, battered child syndrome, child abuse syndrome, maltreatment syndrome, and cafe syndrome. It refers to a child who is victim of repeated beating or torture, usually by his parents, child being in 2 to 5 years age group. It is completely, or say, is rare in India. So what are the causes? Loss of temper, excessive anger, drugs or drinks, poverty, illegitimate children, unwanted children, and mental imbalance of parents. So these are some of the causes of cafe syndrome. What about the features? Child should be in 2 to 5 year. Child is commonly in 2 to 5 year age group. More common for male child. Parents usually in 20 to 30 years age group. Uneducated, low socio-economic class. History of family disharmony, emotional or financial problems. Father usually has criminal record, usually out of job, usually battered in his childhood. So why he tend to repeat the same with his child also, with his child as well. What about caffeine? Effects of violent shaking of child, there results subdural hematoma and intraocular bleeding. This is known as infantile whiplash syndrome. Very, very important. What is infantile whiplash syndrome? Whenever the baby is shaken so hard, then there is subdural hematoma and intraocular bleeding occurs. So that is called as infantile whiplash syndrome. Remember. Then, what are the findings in this syndrome? Child may be physically or sexually assaulted or tortured mentally. There may be multiple injuries, bites, burns, or fractures. There are multiple injuries, maybe fractures of different ages, indicating different timings of their causation. There may be multiple scars of old healed injuries. Child may be maimed for begging. Then there may be deprivation of food, care, or affection. What about diagnosis? Crucial aspects are multiple injuries or fractures of different ages, delay in seeking medical treatment, a gross discrepancy in explanation by parents and nature of injuries, and what is cause of death? At times, death may result from fracture of skull, intracranial hemorrhages, injury to internal viscera, and burns and scars. So these are the causes of death and the diagnosis. Even the characteristic features and definition and the other names. Remember, I'm again repeating, battered baby syndrome is also called as cafe syndrome, not cafe coronary. Moving to next question, what is sudden infant death syndrome? These two are completely different from each other. Sudden infant death syndrome is also called as SIDS or cot death or crib death. Definition: SIDS is defined as the sudden natural death of an apparently healthy child below 2 years, usually at 2 to 4 months, and the cause of death cannot be explained even after a careful PM examination. So that is called as sudden infant death syndrome. Because death usually occurs during sleep, it is also called as cot or crib death. As per WHO, SIDS is a natural cause of death. Okay. So what are the characteristics? Incidence about 0.3% of all deliveries. Male is to female ratio is 3 is to 2. More observed more in twins. Incidence more in low socioeconomic group. Incidence more in rainy or winter season. Incidence more in mothers who smoke or abuse drugs. Then deaths more during late night. So these are some of the causes of sudden infant death syndrome. What are the causes of death? Some suggest that these infants have prolonged sleep apnea leading to hypoxia and death, prematurity, debility, respiratory infections, laryngeal spasm, hypersensitivity of respiratory lumen, then hyperparathyroidism, cortisone deficiency. And what about PM? Usually no positive findings. So medico-legal aspects, cot death may be confused with infanticide and vice versa. So these are some of the features of your SIDS, sudden infant death syndrome. Moving ahead with next question, what is live birth? Enumerate signs and what is hydrostatic test? As per English law, live born refers to a child who is completely delivered outside the body of the mother, irrespective of severance of the cord, and if this child showed signs of life and is killed, it amounts to infanticide. I think you people got this. If a child is born who is completely delivered outside the body, irrespective of severance of the cord, and if this child showed signs of life and is killed, it amounts to infanticide. As per Indian law, even if a part of the body of the child is outside the body of the mother, and if he was alive, killing him amounts to infanticide. So in English law, child should be completely delivered out of the body of mother, but in Indian law, even if part of the body is delivered out of the mother, and if the child shows signs of living and if he is killed, then that amounts to infanticide. Evidence of live birth in civil cases, in criminal cases. So what is the evidence in civil cases? Crying. At times the child may cry in the vagina, which is vagitus vaginalis, or may cry in the uterus, even after rupture of membranes. Air enters uterus and that is called as vagitus uterinus. Basically, in civil cases, what is the evidence of childbirth? Crying is the main evidence. The baby may cry even inside the vagina as well as inside the uterus. Number 2, muscle movements, sneezing and yawning. Number 3, pulsating umbilical cord. Number 4, inspecting, palpating or auscultating fetal heart sounds and pain sensation on pinching. So these are the signs of live baby or say evidence of live birth in civil cases. What about criminal cases? Court requires establishment of live birth on specific grounds and considers establishment of respiration as an important sign of live birth. So in criminal cases, sign of respiration is important sign basically. Establishment of respiration is important sign, but in civil cases, these five things are the evidences of live birth. Coming to signs of live birth. Now, actually, what are the signs of live birth? Number one, establishment of respiration, shape of chest, position of diaphragm and lungs. In lungs, you're going to see volume, consistency, color, weight, microscopic examination and hydrostatic test. Number two, changes in stomach and kidneys. Changes in stomach and intestine, then changes in kidneys. Yeah, so these are the 3 points which denote signs of live birth: establishment of respiration, changes in stomach and intestines, and changes in kidney. Remember, whenever you encounter a word respiration, you have to describe chest, you have to describe diaphragm and your lungs. Fine. Coming to hydrostatic test. It is also called as Raygatz's test or first life test. Very, very important. Raygatz's test, first life test, hydrostatic test. What is the definition? It is the test involving flotation of lungs on water to confirm live birth. Principle. The specific gravity of a non-respired lung is 1040 to 1050 and of respired lung is 940 to 950. So the respired lung floats on water because we all know specific gravity of water is 1000. So the non-respired lung is heavy, obviously. That is why it is going to have 1040 to 1050 specific gravity, and the one which has already respired is going to have 940 to 950 specific gravity. The increased volume of lungs after respiration well compensates the increase in weight after respiration. Yeah. So what is the procedure? Both the lungs together along with trachea and larynx are removed and tested for flotation. We are talking about PM examination in child. Okay, so what is the procedure? Both the lungs together along with trachea and larynx are removed and tested for flotation. If they float, each lung is separately tested. If they float, each lung is cut into 12 to 20 small pieces and tested for flotation. If still they float, the pieces are squeezed under pressure and again tested for flotation. What is the inference? The pieces float even after squeezing. Squeezing removes the tidal air, but residual air still remains. That confirms your live birth. Number 2, the lungs float but pieces sink after squeezing. It may be feeble respiration, may be non-respired lung. Initial flotation may be due to decomposition or attempted artificial respiration. Then the lungs and pieces sink down because it may be not live born, may be live born, but lungs sink due to atelectasis, pulmonary edema, bronchopneumonia. So these are some of the features, okay, inferences which we draw out of the observation. Fine. So it is very important that even after squeezing, the pieces should float on the water because of the residual breathing or say residual air. So that 1000% confirms your live birth. Now what are the objections or fallacies? Number 1, a non-respired lung may float. Example, because of decomposition, the gases of the decomposition collect in the connective tissue, causing flotation of the lungs, but on squeezing, the pieces sink down. Number 2, attempted artificial respiration. Some gases may collect in lungs, causing earlier flotation, but pieces sink down on squeezing. So, flotation after squeezing is very, very important in determining the live birth. Number 2, in case of feeble respiration, the lung pieces may not float, maybe due to the air has not reached alveoli. The little air present is absorbed into the circulation, occurs readily if respiration stops before circulation, and the expiratory volume is more than the inspiratory volume. The respired lung may sink down, example, in few of the cases, atelectasis, your pulmonary edema. So what is atelectasis? Due to the formation of this false membrane lining the alveoli called as alveolar duct membrane. So in atelectasis, you're going to have, hyaline membrane disease, or say false membrane lines the alveoli, and that is called as alveolar duct membrane, and that disease is called as hyaline membrane disease. So air entry into the lungs is prevented. Atelectasis may result due to deficiency of surfactant, abnormal external pressure, tumor, foreign body, meconium, or aspirations. Then number 2, causes resulting in increased specific gravity of lungs, example pulmonary edema and bronchopneumonia. So these are some of the features of your objections or fallacies of the test. But remember, you have to define the test, you have to write the aim of the test, then you have to differentiate based on English law and Indian law, if you remember. Then procedure, write procedure, inferences, then fallacies if you want to write, and conditions. Conditions where the test need not be done, where dead birth confirmed, age is less than 180 days, signs of maceration, decomposition and mummification, and monster baby. Then live birth is confirmed by atelectasis, altered milk present in stomach, or umbilical cord is shed off after mummification. So these are the conditions where the test need not be done. Now what are the changes in stomach and intestines? In case the child has respired, some of the air also enters GIT. Air can be demonstrated radiologically. So air enters or air reaches up to stomach in 5 to 10 minutes, and air reaches up to small intestine in 1 to 2 hours. So air reaches up to colon 5 to 6 hours, air reaches up to rectum 10 to 12 hours. What is Brislow's second life test? Brislow's second life test, in case respiration has occurred, the stomach would also float on water because of air present in it. After ligating at both the ends, stomach is removed and tested for flotation. This test is useful in cases of prevention of air entry into lungs, but it is useless after decomposition or in cases of attempted artificial respiration. So that test is called as Breslau's second life test. A test in which you check flotation of lungs, that is called as hydrostatic. Test in which you check flotation of stomach, that is called as Breslau's second life test. Before respiration, stomach contains only mucus, while after respiration, it contains mucus, air and saliva. So if stomach is punctured underwater, air bubbles will be seen. Presence of altered milk in stomach confirms live birth, and presence of blood, meconium and liquor amnii in stomach confirms live birth. Meconium is bile plus mucus. Okay. Now what are the changes in kidneys? Presence of uric acid crystals as brown streaks at pelvis of kidney is regarded by some as a sign of live birth, but it is not confirmatory. So basically presence of uric acid crystals, which later changed to brown streaks. So this was all about your live birth and the science and about hydrostatic tests. So remember, you have to write about evidence of live birth in civil and criminal cases. You have to write signs of live birth, which is establishment of respiration, changes in stomach and intestines, and changes in kidneys. So you can include the point which we read now in your kidney point and stomach and intestine point. And establishment of respiration, in that you can write many things. You may also write the procedure, the inferences, even the fallacies, and also the conditions where the test need not be done. So this was all about the, live birth. Now we are going to read about establishment of respiration again. So just for the sake of revision, I'll read it again. Yeah, so this is going to be the last question of this video. And yeah, so establishment of respiration, what are the signs before respiration and after respiration? So number 1, shape of chest. Just imagine, before respiration, shape of chest is flat and circumference of chest is 2 to 3 centimeters less than circumference of abdomen at umbilicus. But after respiration, shape of chest is arc, dome or drum shaped, and the circumference of chest is 2 to 3 centimeters more than the circumference of abdomen at umbilicus. So you can imagine, before respiration, obviously the circumference and the size and the shape of the chest is going to be comparatively smaller, or say comparatively lesser than the shape of the chest after respiration. What about position of diaphragm? Very important MCQ. Before respiration, it is at 4th to 5th rib in a child. After respiration, it is at 6th to 7th rib. What about lungs? Volume. Lungs are small, lying posterior part of pleural cavity. Margins are sharp, pleura thick and loose. Then in the second part, lungs are voluminous, fill the whole of the pleural cavity. Margins are rounded, pleura is thin and stretched. What about consistency? Lungs are firm and liver-like. Lungs are soft, spongy and elastic. Color is dark brown like liver, but due to entry of air and passage of blood, lungs are mottled, that is marbled. On squeezing the cut section, little fluid blood oozes out. But on squeezing the cut section, frothy blood oozes out. Why frothy? Because obviously air molecules are present. Weight 30 to 40 grams, static test or Fodder's test. Remember, see, other names of every test you have to remember anyhow, because in question they may ask any test, right? Example I gave you already regarding battered baby syndrome is also called as cafe syndrome. Then 60 to 70 grams are present after respiration. Weight of lungs is 1/70th of the total body weight, that is Plauquet's test. What is Plauquet's test? Weight of lungs is 1/70th of total body weight. What about weight of lungs? Doubles due to increased circulation and is 1/35th of the total body weight. What about microscopic examination? Alveoli is collapsed. Alveoli is lined by cuboidal columnar cell. Blood vessels are not prominent. Alveolar duct membrane cannot be present before respiration. What about after respiration? Alveoli are dilated. Alveoli lined by flat squamous cells. Blood vessels are patent and prominent. Presence of alveolar duct membrane, which is atelectasis, confirms the live birth. What about hydrostatic test? Obviously, it is going to be negative in before respiration wala part, and it is going to be positive in after respiration. So this was all about your live birth. Enumerate the signs and not symptoms, but you have to enumerate the signs and what is hydrostatic test. Remember hydrostatic test, Blockwood's test, then your Gravendex test in case of signs of pregnancy. All these tests have to be remember, because in MCQs will be asked about these tests. What are these tests and why they are done exactly? Hydrostatic test is very important because it is, famous SAQ. And yeah, this was all about part 1 of your medical legal aspects of sex, marriage and family planning. But in part 2 is still remaining. A few questions are still remaining regarding MTP Act and further questions. So those would be covered in part 2. See you in the next video then. Until then, keep learning, keep growing. Bye bye.